Now, these people you see on your screen are going about their normal activity without wearing a face mask. Now, this is despite a public health directory making it mandatory to wear a mask whenever you leave home. It may not come as a surprise, as many believe that Ghana is out of the woods, especially when COVID-19 cases keep dropping. Well, even when Ghana first recorded its first imported case in February, one commodity that was on high demand, expensive to buy, was a face mask. Now that restrictions have eased, the cost of these face masks has reduced drastically by over 100%. Now, watch this conversation I had with the head of sales and marketing for East Cantonment Pharmacy, Ebenezer Holmes-Graves, together with Joseph Boidi, a pharmacist, on the cost of PPEs now that restrictions have eased.
Let's face it, as of now, these things, the nose masks and the sanitizers, have become a daily usage thing. Okay. Now, the ordinary man on the street, which is the mass of the people, if you're asking him to buy a face mask for 1 cedi and it's usable for just a day, for 30 days, that's 30 cedis. That doesn't impact on his pay packet.
So he can't repeat it for 2 days? No. It's disposable. So.
Disposable, you understand?
Yeah, sure.
So it's supposed to be changed, if I may, every 8 hours. So in a day he might need about two.
Yeah.
2 of these in a day?
Yes.
Yeah.
Okay. Yeah. And considering the fact that it has become an everyday thing, then we need to look at it more. And I think that it will help if government thinks along those lines, if they can subsidize the importation or the manufacturing of these products, which are obviously a daily requirement now. Inevitably, it hits the end consumer price. So instead of 1 cedi, maybe you'll be buying it at 50 pesos or 25.
Johnson, you're very concerned. You are, a pharmacist. You have been monitoring the sales of these things ever since we reported our first imported case. How concerned are you? How are people really catching on to the compliance level in these times?
Yeah, thank you so much to all your viewers. I think it's about perception because, like my colleague said, we've seen a drastic drop in demand for face masks, for hand sanitizers, and it's because people think we are out of the woods, but that is actually not the case. There are several countries that are experiencing a second wave, and as much as our cases keep on declining, I think it's still important that we stress what has helped us so far get to this point, and that is the wearing of face masks, social distancing, using of the hand sanitizers. So that message has still got to keep on resonating with the public.
You know what, already government is putting in a lot of interventions. Let's talk about the water bills, the electricity and all that. Those are all large sums of money. It got to a point the government had to provide food for our brothers and sisters who were not working. Now, part of the social intervention, if it's hitting the cost price of these essential items that we have to use every day, and let's think of the mass of the people who obviously cannot afford it, it helps. So let's make some budgetary provision instead of everything going into water and electricity. That's something that the people must use every day. So it gives justification that, yes, some of these interventions must be redirected to support the consumption of face masks, hand sanitizers, and the rest.